Caregivers of people with mental illnesses have asked for stronger support in areas such as insurance. The call came at an annual conference today that brings together some 200 caregivers of those with mental health conditions.
Some caregivers believe that if all private insurers classify certain mental health conditions like schizophrenia as a critical medical illness, it will help destigmatize mental health and also alleviate financial burden on the family.
As an outpatient care person, there would be certain constraints and limitations as to how much he can access, whether it's in terms of subsidies or in terms of medical coverage.
The Caregivers Alliance has started reaching out to private insurers to see if these issues can be addressed, but acknowledged that it's an uphill battle.
In order for insurance to come in, there must be an ability for them to commercially make it viable and to bear that risk. So it's an ongoing dialogue and discussion, and we are happy that so long as there's greater awareness and the conversation continues. We've seen how public policy has stepped up and improved in the last few years, and there's a lot more done already. But public policy can't cover everything.
Currently, MediShield Life covers inpatient treatment of psychiatric conditions. Medisave can also be used for outpatient treatment of certain mental illnesses. At the conference, Senior Minister of State Dr. Amy Khor said caregiving needs will grow in tandem with Singapore's rapidly aging population. And while the government will continue to build on programs to better support caregivers, the community also has a role to play.
The government recognizes that we cannot do this alone. We need to work with the community and society at large to build ecosystems of care around our caregivers and their loved ones.
Ultimately, the Caregivers Alliance stressed that the fundamental challenge is to educate society at large to destigmatize mental health conditions such as dementia,